Welcome to another episode of On the Front Line at Dr.Allen, LA. Today there's two key things I'm going to emphasize. One is why our administration and local government is enforcing the use of the mask. You will see here we have increased our use of PPE, which is known as the gear that you use, protective gear that you use in the fight of the coronavirus. Second of all, this individual is someone who's been back and forth to Mexico. He's had multiple shots of penicillin, did not improve. He comes back today, high fevers. The family realizes that we're the only person or only entity in this area that's testing and brings him to me to be tested for the coronavirus. Please watch.
Again, I'm emphasizing the gear. The first part of the gear is here, which is our underlining mask, which is this mask. We then have our next mask, which is our topical mask, which is here to support our actual underlining mask. We also have a very sick, ill patient today who may have the virus itself. We're now using hand sanitizer. Following that, we have our second set of gloves that we're using as precautions as well. So we put those gloves, and then we put these gloves on top of the original gloves as double protection for staff and I to protect ourselves against the virus. This virus is increasing in its intensity. A reminder, we've already tested 8 positive so far in Los Angeles County. We do believe that the individual today may actually have it. We have a difference between two masks. Today's mask is going to be a little more intense as I try now to make sure that I don't expose myself to the virus at all. Again, we have a very sick patient who may have the coronavirus as we go and get ready to go in and test. Also have the under and over gowns, the double gloves, and the shoe booties as the disease is becoming more aggressive to be dressed appropriately. Again, we've noticed that the jumpsuits are extremely hot, but this allows us to function during the time that we're here all day to take care of the patients. Okay. All right. All right, ma'am. I'm gonna bump you there.
Yes.
I'm gonna ask the gentleman to sit right here. All right, right here. Gonna have you lay down there. Lay down there. Good. Other question, sir. See.
You want me to go out, or that's okay if I stay here?
Either way. We have a lovely gentleman who we have a great lady that translate and talk to us. As we talked about with the parent, he's been to Mexico where he's had at least 2 or 3 injections for his infection. He has not gotten any better, and I think we currently have Z-Pack that he has, which has not actually responded as well, and he still remains sick, and also he's having back pain. We're now going to test the gentleman for the COVID-19. All right, I'm going to ask you to take your mask down. George, you're going to explain the testing procedure. It's going to, as I said in English, you're going to say it in Spanish for me. Okay? I'm going to be using the tip to put to the back of his nose here. I'm going to stop for a second. And then we're going to get a good sample. Good job. You did an excellent job. We will be back in. You'll translate for me. We'll be back in to give him the antibiotic shot. And is he going to continue the azithromycin you have? Or do you need any more?
He wants an injection.
Yes, only injection, and you already have the other medicine.
Yes.
Okay, not a problem.
Mm-hmm.
Okay, they'll be right back in to give the injection.
Okay.
Thank you.
Thank you.
All right, and we're
Thank
gonna
you,
sit
thank
up and they'll be right back in to do
The
the
results
exam.
they're gonna be on
In
Monday.
24 hours. We'll have
Okay.
results in 24 hours. We'll have them tomorrow morning.
Tomorrow, so we can call tomorrow?
Yeah, absolutely. Absolutely.
Perfect. Thank
Absolutely.
you.
You're welcome.
Thank you, doctor.
Now.
As you can see, this disease has really spread. It has increased in its severity, which means now I'm starting to see patients that are really ill. Not like before, randomly a cough, cold, sore throat, and if the CDC guidelines, it's so clear that you had to follow them to test. Here, they're coming in high fevers, multiple antibiotics, resistance, and it's not working. And the family is getting the word out, hey, we better go to Dr. Allen and get him tested to find out if indeed they had a coronavirus. And I'm starting to see a lot of sick patients. I hope these videos are helpful and letting you understand what the front line is doing. Also, I hope the videos is helpful in making sure you increase your safety by wearing a mask. As you can see today, I've increased my use of the mask. Thanks again for watching On the Front Line at Dr. Allen, LA.